What did the panther say at the poker party? I'd be lying if I said I was a cheetah.
You're listening to Weird Medicine with Dr. Steve on the Riotcast Network, riotcast.com.
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for my ailments, the health equivalent to Citizen Kane. And if I don't get it now in a tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, now a podcast. Dr. Steve, and this is a show for people who would never listen to a medical show on the radio or the internet. If you have a question, you're embarrassed to take to your regular medical provider. If you can't find an answer anywhere else, give us a call, 347-766-4323. That's 347-POOHEAD. Follow us on Twitter at Weird Medicine, at Lady Diagnosis, and at DrScottWM. Visit our website at weirdmedicine.com or drsteve.com. For podcast, medical news, and stuff you can buy, or go to our merchandise store at cafepress.com/weirdmedicine. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your doctor, nurse practitioner, physician assistant, pharmacist, chiropractor, acupuncturist, yoga master, physical therapist, or whatever. Hey, don't forget to use stuff.drsteve.com if you need to go shopping on the internet. Particularly if you are in need of something from Amazon, go to stuff.drsteve.com. We've got all kinds of things that we talk about on the show on there, and also a link to just go straight there. It really does help keep us on the air and keep Riotcast going. Don't forget tweakedaudio.com, offer code FLUID, F-L-U-I-D, for 33% off. The best earbuds for the price on the market, the best customer service anywhere. And check out Dr. Scott's website at simplyherbals.net. I guess I'll invite him back to the show someday. And if you would like to listen to archives of this show or would like to support us in that way, just go to premium.drsteve.com. And I recommend using the Weird Medicine app from the from the App Store on iTunes or Google Play. That's the easiest way, and it's a really small app. And if you go to premium.drsteve.com for $1.99 a month, you get access to whatever premium content is there, and archives to our shows going back to day one. And it's $1.99 a month if you really, whatever. You could do it for 1 month, download everything, and then just quit. And that's fine too. But anything that you can do helps us. There's no question about that. All right. Let's get right to it. There has been a lot of furor in the news media regarding what's going on in California regarding coffee. So this is from CNN. California coffee shops may soon be forced to warn customers about a possible cancer risk linked to their morning jolt of Java. The state keeps a list of chemicals it considers possible causes of cancer, and one of them, acrylamide, is created when coffee beans are roasted. A lawsuit first filed in Los Angeles Superior Court 2010 by the nonprofit Council for Education and Research on Toxics targets several companies that make or sell coffee, including Starbucks, 7-Eleven, and BP. The suit alleges that the defendants failed to provide clear and reasonable warning that drinking coffee could expose people to acrylamide. The court documents state that under California's Safe Drinking Water and Toxic Enforcement Act of 1986, also known as Proposition 65, businesses must give customers a clear and reasonable warning about the presence of agents that affect health, and these stores failed to do so. In addition to paying fines, the lawsuit wants companies to post warnings about acrylamide and an explanation about the potential risks of drinking coffee. If the suit's successful, the signs would need to be clearly posted at store counters or on walls where someone could easily see them when making a purchase. So the whole coffee, is it good for you, is it bad for you thing has been in the medical literature on and off for years. And it is true that when you roast coffee beans, a small amount of this acrylamide is produced. Guess what? It's a slightly less, depending on the bean and how you do it, than what's in French fries. So there's lots of cooking and heat producing food processes that produce acrylamide. And the doses that are required appear to be much, much higher than what is produced when you do coffee beans. But the law says if you know it's there, you have to alert people. So, it doesn't necessarily say coffee causes cancer. What they're saying is we have this list of toxins or carcinogens that if they're in your food, we have to warn you. Well, it's not just going to have to be coffee. It's going to have to be a lot of other things. If they're going to use this standard that any amount is that's present must be listed, because there's going to be a whole lot of other food manufacturers that are going to be pissed about this. Coffee's been studied over the years. Research has shown it provides several health benefits, including lowering your risk of early death. It may reduce your risk of heart disease, multiple sclerosis, type 2 diabetes, Alzheimer's, and even some cancers. But a review by the International Agency for Research on Cancer, a branch of the World Health Organization, found that drinking very hot beverages was probably carcinogenic to humans due to burns of the esophagus. And there was no relation to the chemical acrylamide. So, don't gulp boiling hot coffee. That's insane. And according to their research, hot water would do the same thing. Tea, any other hot things, hot toddies, I guess. Acrylamide, I'm back to the CNN article. In addition to coffee, acrylamide can be found in potatoes and baked goods like crackers, bread, cookies, breakfast cereal, canned black olives, and juice. So if you want to have a nice, tasty bowel movement, you use prune juice, you're also exposed to a small amount of this acrylamide. Its presence not always labeled, and it is a component of tobacco smoke. And people are exposed to substantially more acrylamide from tobacco smoke than from food. Let's see here. In 2002, the International Agency for Research in Cancer classified acrylamide as a Group 2A carcinogen for humans based on studies done on animals. Studies done in humans have found no statistically significant association between dietary acrylamide intake and various cancers, and this was a 2014 review. Let's see here. Okay. Even the studies showing cancer links between acrylamide in rats and mice used doses 1,000 to 100,000 times higher than the usual amounts on a weight basis than humans are exposed to through dietary sources. And humans are also thought to absorb acrylamide at different rates and to metabolize it differently than rodents. So there you go. I found this other article that I wanted to read to you, and this is 2017. And because, look, here, I used to have these drug reps that would come see me, and they'd say, well, our cholesterol medicine lowers LDL by a certain amount, and therefore it should lower heart attack and stroke. And it's like, well, but you didn't show that, because you need to do a head-to-head study against the gold standard. Oh, well, we could never do that. We could never do that. There's no sense in it. If you bring down the LDL, you bring down heart attack and stroke. Well, it turns out that there's another medication that you can bring low-density lipoprotein or bad cholesterol down with, and it's called Zetia. And when you decrease it at about the same level as you do with statin drug, you don't get the same decrease in heart attack and stroke. At least they have not been able to demonstrate that. So it's not just the point is not that Zeti is a bad drug or statins are good drugs. That's not the point. The point is the end point should not be some intermediate step. In other words, our endpoint shouldn't be decreasing LDL. Our endpoint should be decreasing heart attack and stroke. And I would tell these reps, if you had a drug that tripled someone's bad cholesterol, made it 900, but you could show that it decreased heart attack and stroke, I'd write it, because my interest is not in reducing LDL. My interest is in reducing heart attack and stroke. Likewise with this, my interest is not, is acrylamide present, does coffee cause harm? That's what we're really interested in. So I'm rustling these papers. This is a study from Mayo Clinic Proceedings. This is not some bullshit open access journal. Not that all open access journals are bullshit, but I'm just saying this is not a bullshit journal. It's from 2017. And the title is Association Between Caffeine Intake and All-Cause and Cause-Specific Mortality. In other words, they're going to look at just mortality in general without looking at what people died from it, not heart attack, cancer, any of that, just how many people die who take caffeine every day and how many people die who don't, okay? This is not necessarily coffee. This was caffeine, but still very interesting. So they had 17,594 participants. The mean, let me see, follow-up was 6.5 plus or minus 3 years. And compared to those who had caffeine intake of less than 10 milligrams per day, confidence intervals for all-cause mortality were significantly lower in participants with a caffeine intake of 10 to 99 and 200 or more. So a similar association was observed in participants who consumed less than 1 cup of coffee per week. And let me see, what are they? Oh, the hazard ratio, okay, was lowest in those with a caffeine intake of 100 to 199 milligrams per day. There was no association between caffeine intake and cardiovascular mortality, whereas the hazard ratios for non-cardiovascular mortality were significantly lower in those with caffeine intake of 10 to 99 milligrams per day. And 200 or more. So anyway, what they decided was moderate caffeine intake was associated with a decreased risk of all-cause mortality, regardless of the presence or absence of coffee consumption. How about that? Regardless of the presence or absence of coffee consumption. So whether they drank coffee to get their caffeine or not didn't seem to make any difference, really, but an increased amount of caffeine led to decreased mortality rates. So these numbers, again, are going to be small out of that group. Only a small number of people died in both groups, but there was a statistically significant difference in the group that had more caffeine in their body. So very interesting. That's what I'm really interested in. Now I want to see one of these on coffee itself. And if we can show that coffee decreases all-cause mortality, then the fact that there is a suspected carcinogen in coffee really doesn't matter, does it? Because the end result is decreased death, which is what we're really interested in. Okay. All right. Well, anyway, let's see here. Let's take some phone calls.
Don't take advice from
Dr.
some
Steve.
asshole on the radio.
I got a question.
Wait, what'd you say, Ronnie B?
Number one thing, don't take advice from some asshole on the radio.
Well, isn't that the truth? All right, here we go.
About what appears to be a plantar wart. My fiance and I have showered on occasion, and she had it first. And I'd say it's now been about a year and a half or so, and we've tried different methods to get rid of it. I think the Dr. Scholl's freezing thing that you're supposed to apply, and then it's supposed to kind of fall off. That didn't work, and then we used the, I think it's some sort of saline acid or something that you put on it. That also just doesn't appear to work. And in previous times when I've had plantar warts, they've come off fairly easily, or at least within a couple weeks. But again, just not kind of sure what it is or what can be done to get rid of it. If it's just something you have to kind of just let it run its course. I'm not sure how long it's supposed to last. Like I said, it's already been...
Okay, well, plantar warts. So these are warts on the bottom of the sole of the foot, and they are caused by human papillomavirus, and the damn virus gets in there and starts to reproduce and then walls itself off. So if you ever looked at one of these, they're surrounded by sort of a capsule of very dense skin that is very dense keratin. Keratin, same stuff that your skin is made out of, also your hair and stuff like that. It's sort of the body's plastic. So it's like they're walled off with plastic, and they recruit their own blood cell or little capillaries to keep the cells alive so that they can reproduce. Because as you know, viruses have no life on their own. They have to hijack the nuclei of other cells to make more copies of themselves. So they'll just sit in there and just fiddle around and keep going for quite some time. And it's hard for the immune system to get in there and kill them. Most adults don't have plantar warts. Matter of fact, most children who have them will not have them when they're adults. I had them really bad when I was a kid. Finally, in college, somebody scooped a couple of them out. My immune system caught whiff of them and went in and killed the rest. And the bottom of my feet have been clear ever since. And one of the things you want to do is avoid doing so much damage when you scoop these things out that you cause scarring. Because if you can get the body's immune system to kill the HPV viral particles, then the foot will heal up and it'll be nice and smooth. But if you've been cutting around and digging and causing scarring, now you're going to always be walking kind of on these scars, and it feels like you're walking on a rock or something. So I would not do this myself. I don't think the over-the-counter stuff works for the really deep-seated plantar warts, maybe the little small seed ones that you see right on the surface that I haven't dug in very well. But the real big, deep ones with the big sort of keratotic covering, you got to see a podiatrist for those. Your primary care, if they did some podiatric training, may be able to handle it. But I'm just telling you, my experience has been podiatrists are the best at these. They get in there, dig them out, and a good podiatrist can do a beautiful job of coring these things out. And once you do that, your immune system may, as I said, get a whiff of those viral proteins and then go, what the fuck are you doing here? And then get in there and kill the rest of them. So the body can clear HPV. We just don't have a good test that shows that it did. But with plantar warts, you can tell because you don't have any warts anymore. So that's sort of your marker of success. So see a podiatrist and get these taken care of because you don't have to live that way. All right.
Today's episode is brought to you by Angie. Angie has made it easier than ever to connect with skilled professionals to get all your jobs and projects done well. Let me tell you, there's the version of it where you try to do something at home, and then there's a version of it where you have someone help you, you watch them do it the right way, and you go, thank God I didn't try to do that myself. I have fully done things around the home that I think look good, and then a bang in the night, and I wake up to a shelf collapsing, a painting falling off the wall. I've seen it all go south. I own a home, and I can tell you, I know how much work it can take. Whether it's everyday maintenance and repairs or making dream projects a reality, it can be hard just to know where to start. But now all you need to do is Angie that and find a skilled local pro who will deliver the quality and expertise you need. Whatever your home project, big or small, indoor or outdoor, you can Angie that and connect with skilled professionals to get the project done well. Right now, one of my wish lists is I want a bike for my condo in Milwaukee, and I would love to rig it up on a pulley in the ceiling because I have one of those lofted ceilings, but I'm so scared to try that on my own. Angie has 20 years of home experience, and they've combined it with new tools to simplify the whole process. Bring them your project online or with the Angie app. Answer a few questions and Angie can handle the rest from start to finish, or help you compare quotes from multiple pros and connect instantly, which means you can take care of any home project in just a few taps. Because when it comes to getting the most out of your home, you can do this when you Angie that. Download the free Angie mobile app today or visit Angie.com. That's ANGI.com.
Hey, Dr. Steve, it's Phil. I was listening to the episode of Evie, the Night Nurse, and you guys were talking about that DNA testing they do, and you send it in. I had a friend that did that, and got his results. I always felt like you're just giving more than a Social Security away. You're giving a DNA to somebody. Now, my question is, as a doctor's perspective, would that be something that you would be kind of scared to do because it's out there, now they got your DNA?
Well, that's an interesting question. The question is, what are they going to do with it? If we were using DNA to secure loans or to validate credit card transactions, then yes, I would be very worried about it. But the thing is, anytime anybody does a blood draw, they can get your DNA. If they can get a follicle of your hair, they can get your DNA. It's very easy to get a hold of people's DNA. It's just, what are we going to do with it? Those reports just come back and say, well, you're 10% sub-Saharan African, you're 30% Northern European, possibly of Swiss descent or whatever, and there really isn't anything they can get from that they can use. So I'm not worried about it. One thing I would like to do an experiment where we get the same person gives a sample to 3 different places and see if they all come back the same. If they do, then I'll feel like they're really doing something. If they come back all over the place, that would be very revealing to me. Because I'm always a little skeptical when they can say, your descendants are from Portugal or whatever. I'm skeptical, but I would like to try that. And if I ever do a television show, sort of a medical Mythbusters type thing, and we've talked about that in the past, that's one of the experiments I would love to do. That and repeating the vodka tampon. And if you guys don't know what the vodka tampon is, we did a controlled trial here in the studio, and it's way, way, way back when Double Vasectomy Todd was still here. So you'll have to get a premium subscription to listen to that one, but it was pretty interesting. Also that and the ass crack challenge, which I would probably repeat on television as well. And just how different flatus sounded when it was no longer muffled by hair in my ass crack. It was quite astounding. And I believe that one is in the archives as called the ass crack challenge. Anyway, all right.
Let me see if I can explain my question here. How does a pill work? Let's say I've got a sprained ankle. The doctor gives me something for inflammation. Does that area essentially, for lack of a better phrase, put out a help wanted sign? So when you take a pill, the brain knows there's an injury, so it tries to route the medicine that way? Or does the medicine just kind of float through your system from your earlobes to your toes, and if it happens to find something it can help, it does it that way?
Yep, it's the latter, except in one condition. And this is sometimes the objection I have to taking pills. For example, if someone has pain on the first knuckle of their hand, why take a pill that's going to go to the tip of their toes, to their scrotum, to their ass crack, to their ear, to their, how many parts of the body can I name? Just to get medicine to that one knuckle, to that joint. Why not put something topical there if you have it? And we do make topical medications that are good for those kinds of pains. So, they're, that anti-inflammatory is going to just float around, and it will have action wherever there are receptors to accept that action. It could be everywhere in the body, but you'll only notice it because you only had pain in the knuckle or in the tooth or something like that. Now, there are things called monoclonal antibodies, And these also just float around when you take them. And these are what they are is actually immune molecules, or they're molecules that the immune system uses. And a monoclonal antibody is a single antibody that will target a specific protein. So it could be cancer basement membrane, or it could be a protein that is found in cancer cells that recruits blood vessels, stuff like that. And those will float around and go everywhere again, but will only attach where that protein is found. So they're a little bit more targeted in that regard. But there's no internal routing that the brain goes, oh, this guy took ibuprofen, I'm going to route all of that to that first knuckle. There's no mechanism for that. So, but anyway, so excellent question.
Hey, Dr. Steve, I just had a random question. Google wasn't really helping me out. My ex-wife and I had a child together. We separated. She's now pregnant from her boyfriend, and my girlfriend is pregnant from me, hopefully. And my question is, I was just kind of wondering, will our son, my ex-wife and mine, son be like equally related to her new baby and my new baby, or does the dad have, or like?
Oh, that's really interesting.
Is the dad's baby going to be more related to him, or I don't know if this even makes any sense. I don't know how to really word this, but.
Okay, no, that's a great question. So, the child that you had with your ex-wife will be the half brother of any child that they have together and any child that you have with your new person. And that child has 50% of your genes and 50% of hers. Now, they're not expressed exactly 50%. There may be dominant recessive genes, and there's a complex mix when you start mixing. But the genetic material is half yours and half hers. So her new lover will have no DNA in common with the child that you had with her, but he will produce 50% of the genetic material for the child they have together. And your wife will, your ex-wife, will give 50% of the genes to the new kid, and she gave 50% of the genes to the kid that you have now. So there will be no difference in the amount of genetic material of hers that's in those. And same thing with you. You gave 50% of the genetic material in the kid that you have now and in the kid that you're having with your new paramour. But the kid will be half brother to both of those children, if that makes sense. All right. Uh-oh. There we go.
The other day I was, taking care of us. I masturbated, and
excellent.
A little bit of blood came out on the first couple shots. Kind of had me worried. Went to the doctors. They told me I should get a prostate exam, and I wasn't really comfortable about going with that, especially because my doctor had big fingers.
Big
kind of worried
meaty.
about that. I'm 29 years old. I didn't think that was really something that I had to worry about at this age. Just curious what you think, I guess. Thank you.
Yeah, man.
Yeah.
Okay, so he had an episode of what is called hematospermia, which is usually a distressing symptom for patients, causing them to call into radio shows and stuff. But it's often, if you've got a decent primary care physician, they can handle it. It's almost always benign, but you've got to rule out underlying pathology. So this is the same as Dr. Steve's rule for blood in the stool. If you see blood in the semen, the first time it should be worked up. Often men who are younger than, say, 40 to 45 years and don't have any risk factors. You don't have a history of cancer, no genetic malformations, any trauma, anything like that, it's usually requires nothing other than reassurance of the patient. Some primary care people or urologists will put you on an antibiotic because they're assuming that there's an infection there. When you get a little bit older, or if you are sexually promiscuous, then you got to be tested for sexually transmitted diseases. And particularly if you have lower urinary tract symptoms like burning or any of that, or burning when you pee or burning when you ejaculate. Now, if you're older than that, most of the time a prostate check is required. When it happened to me, they did a cystoscopy and they're looking for polyps in the urethra and polyps in the part of the bladder in the part of the urethra that's just coming from the bladder where semen is mixed and with sperm and seminal fluid from the seminal vesicles and from the prostate. And they'll check your prostate as well, make sure you don't have a prostate infection. Again, might end up on antibiotics, but more of a workup is done in older people like me because I'm an old piece of shit. So I had to have a little bit more. But hematospermia scary should be evaluated at least the first time, and but most of the time is going to be benign. All right. I'll do one more.
Hey, Dr. Steve, Dr. Scott, everybody else. My name is Ray. I have a question about my shoulder. I listened to the podcast. I'm hoping you can put that on there. A couple years ago, I had a tear in the rotator cuff muscle. It didn't come off either end. The doctor said it was a vertical tear in the muscle itself. I went through the whole PT process, stretching and pulling and everything else, and it seemed to help. I got most of my strength back. I had pretty minimal pain. But in the last couple of months, I've had increasing pain, especially when I rotate the arm upwards and back, almost like if I'm trying to do the jumping jack position or reach for something behind my head. I get real significant pain. And when I'm sleeping, I usually sleep on my stomach with my arms up on top of me. I wake up after about 2 hours, the arm is completely cold and incredible pins and needles to the point where I'm having real trouble sleeping. I turn over and it gets warm again, and I don't think I'm losing a pulse in it or anything, but I was wondering if there's something I can do as far as maybe something on the Dr. Scott side where I could take something maybe with astragalus in it or something to help me have this joint pain go away, and or if there's some sort of manipulation or acupuncture or something that might relieve some of this pain and get me back mobility, strength.
Well, maybe. Maybe we'll ask this one when Dr. Scott is here. But what I'm concerned about is either recurrent. Okay, so this guy is having pain when he rotates the shoulder up and back. So external rotation and what we call abduction. And in getting, which you have to do to get into the jumping jack position. And he has pain. That starts to make you think that the rotator cuff is involved. There's if you feel the shoulder muscle, and if you go right to the side of your shoulder, it's all meaty. But then if you work up closer, get up closer to your neck, you'll see it turns into bone, right? Well, that shoulder muscle doesn't just disappear; it goes under that bone. And it's called the acromion process. And it has to slide, and there's there's tissue in there that kind of lubricates that joint. And if you get a little bit of a raggedy edge on that acromion process, when you lift your shoulder up, it can start to strip off cell after cell of muscle tissue until eventually it rips a hole or a tear in that that bundle of muscles. And that's called a shoulder impingement syndrome. And, of course, that would certainly be exacerbated by abduction, in other words, lifting the arm up away from the body, and external rotation, in other words, rotating it, outward and backward to attain that position. So that's one possibility. The easiest way to determine whether that is the case is a physical exam by somebody who knows what they're doing, and then maybe an MRI to see what the extent is. If it is just a bursitis of the shoulder, that's pretty easy to diagnose by a skilled diagnostician. They can stick some cortisone under the shoulder or under the collarbone near the shoulder, and the pain will just go away. And that requires some skill. I was pretty good at that when I was doing them back in the day. Getting it right in the right place so that you're putting it in that little sack of fluid, and rather than, well, that's Dr. Scott himself, so I'm going to click, tough shit, asshole, you're late. It takes some skill to get it in the fluid sac and not jabbing it into bone or tendon tissue. But anybody that's going at that probably has done a few of these and is relatively skilled at doing it. The third thing, though, that makes me concerned in your case is that you are having numbness and coldness when you move your arm over your head and leave it there. That starts making me think of a thing called thoracic outlet syndrome. There's a thing called vascular thoracic outlet syndrome. And what this is a disorder that occurs when blood vessels or nerves in the space between the collarbone and the first rib are compressed. It can cause pain in the shoulder, it can cause pain in the neck, and numbness in the fingers and hand. And this can be caused by physical trauma, repetitive injuries, people who have an extra rib, even pregnancy, which probably is not his problem. So sometimes they don't know. And the vascular thoracic outlet syndrome occurs when one of the veins or arteries under the collarbone are compressed, and that's really about the only thing that would cause a limb to go cold like that. So I would look into that. There's tests that can be done in the office that are simple physical exam type tests that can lead you in the direction of thoracic outlet syndrome. If you don't know who to go to for this, start off with your primary care and just tell them that you read somewhere, that you heard somewhere that this could be what the problem is. They'll do provocative tests. These are designed to reproduce your symptoms. If they can do that, that kind of confirms it. Then they might do an X-ray or an ultrasound. Particularly if they think that it's vascular, they can do an ultrasound where you put your arm behind your head and they watch for decreased blood flow to that limb. And then just regular imaging like an MRI or angiography might be able to tell too. A lot of times physical therapy will take care of it. Anti-inflammatory medications may help as well. And the few rare people will need surgery for this to relieve the pressure. So just get that checked. Call me back. Let me know. You can always email me at weirdmedicine@riotcast.com. And I'll try to answer your emails if I can't answer your question. And thanks always go to Rob Sprance, Bob Kelly, Greg Hughes, Anthony Cumia, Ron Bennington, Fizz Watley, whose steadfast support of this show never goes unappreciated. Listen to our SiriusXM show on the Faction Talk channel, SiriusXM channel 103, Saturdays at 8 p.m. Eastern, on demand, and other times at Don Wickland's pleasure. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, and get some exercise. We'll see you in 1 week for the next edition of Weird Medicine.